Hello everyone, this is Dr. Suresh, faculty for biochemistry, and in this video we will be talking about collagen disorders. We have already made a video on collagen synthesis. For better understanding, please watch that video before going into this video. So to begin with, collagen disorders. There are two types collagen disorders. One is if there is enzyme defect in collagen synthesis, and other one, collagen synthesis absolutely fine, but because of some misguidance of immunal cells in our body, there are auto antibodies which have been generated to target the collagen. Okay, auto antibodies which generated to target against collagen. Okay, so these are the two types, right? First we will see the enzyme defective disorders related to collagen synthesis. So we have already seen that there are plenty of types of collagens are there, like 20 types of collagen are there. So we will go one by one. Type 1 collagen synthesis disorder, it is because of the enzyme deficiency, right? Here total collagen itself defective, especially it happens in bones, and this condition is known as osteogenesis imperfecta. Name itself suggests. Okay, so the defective collagen that will be in osteogenesis imperfecta will be type 1 collagen, and it exclusively takes place in bone. This defect happens in the bone. So what are the things about the clinical features of this? So we have seen that type 1 collagen is present in the sclera of the eye, right? So here the cornea, the sclera of the eye is white in color. As the defect in type 1 collagen, the sclera of the eye will be bluish, is called blue sclera. So that is a characteristic feature of type 1 collagen deficiency, okay, which in place of white sclera there will be bluish colored sclera. And next is type 2 collagen synthesis disorder, which takes place in cartilage. So the condition you can say here it is chondrodysplasia. And third one, that is type 3 Ehlers-Danlos syndrome. So in this, what is the characteristic feature of this type 3 collagen synthesis disorder? That is, in this all type of collagens will be defective. All the 20 whatever existing are there, all type of collagens will be defective. So in type 1 only type 1 type of collagen will be defective in type 1 collagen synthesis disorder. In type 2 collagen synthesis disorder, it is type 2 collagen, right, exclusive to cartilage. But here in Ehlers-Danlos syndrome, all collagens will be deficient. Right, and you can say what the physical feature you can give about this is, as there is a extensive elongation of the joints, as there is no collagen, so rubber man syndrome, otherwise you can say that is rubber man syndrome. In reality shows you might have seen people who will come, they will extend their arms to such a great extent, they will twist their neck and they will twist their hands all together and they will bend their head to the back. So all these things, like because of this, called rubber man syndrome. And type 4 is Alport syndrome. So the clinical features is of like a triad, okay, it is known as classical triad. So what are the classical triad? It is like as a like type 4, as it is present in basal membrane of kidney and in alveolar membrane of lungs. So here what happens, the prominent feature is hematuria, loss of blood in the urine, and sensual neural hearing loss, and lenticonus. So, third feature is lenticonus. So, here is the cornea of the eye, the curvature, the cornea of the eye will be like more towards interior rather than to the exterior. So, that is a characteristic feature of lenticonus. And other features, if you say, so far these are the features related to collagen synthesis, right. So, this is the type 1 collagen disorders. Now, type 2, what I said, collagen synthesis is absolutely fine, right. There is no problem with the collagen synthesis, but the thing is, because of the misguidance of the immunity of our body, there are autoantibodies which are generated against the collagen. So, they will go and they will destroy the collagen, right. So, we will discuss about those disorders. So, here type 2 collagen disorders, because of auto antibodies against the collagen, right. The first one to be discussed, that is Goodpretzer syndrome. Goodpretzer syndrome. So, here what happens, here lot of hemolysis will be taking place. So, blood in sputum, hemophysis, that you called as hemophysis, the characteristic feature. Blood in sputum, hematuria. So, these are the characteristic feature of this. And second one is bullovesical disorders. What do you say? Bullovesical disorders. So, you have to learn about the structure of like epidermis and dermis before, to understand this bullovesical disorders. So, first we will see the basic unit of how epidermis and dermis. So, we are all aware epidermis having 5 layers. So, one is with corneosome, second is luciderm, third is granulosome, basal and spinosome, right. And dermis is having 2 layers. What are they? Papillary layer and reticular. So, these two things are connected by what? The space between epidermis and dermis. There is a space called subepidermal area. Subepidermal area. So, where this hemidesmosome will be existed, right, where this hemidesmosome will be existing in the space which connects the epidermis to dermis. So, what happens here, the spinosome whatever is there in the epidermis will be attached to the hemidermis first beginning part, and it will be attached to the papillary layer of dermis at the end. So, this is connecting both epidermis and dermis, right. So, hemidesmosome, where it is present, hemidesmosome will be present between the subepidermal area, okay, in between the area of epidermis and dermis, there hemidesmosome will be present. So, now what is the clinical feature of this, right. So, bullovesical disorders, again there are 2 types are there, bullovesical disorders, right. So, here we have learned that desmosome and then hemidesmosome, right. Hemidesmosome, where it will be there. So, in the structure if you see, so this is I will draw the structure now here, this is dermis layer which is having 2 parts, one is reticular layer and other one is papillary layer, okay. And we have that spinosome here above that, and above spinosome we have desmosomes, right. So, this is subepidermal area, epidermal area, this one, right. So we have already discussed that. So hemidesmosome will connect with spinosome to papillary layer of dermis, right. So like this. So now what happens, there are antibodies. So what we said, this is yellow color is hemidesmosome, and desmosome is present in epidermis. This is desmosome which is present in epidermis, right. So here two types of antibodies will be developing against the collagen, especially to hemidesmosome and desmosome. So based on that, if antibodies are developed against hemidesmosome, that is known as bullous pemphigoid, okay, which is showing no acanthosis, okay, and there are antibodies which develop against desmosome, that is known as Pemphigus vulgaris, so it shows characteristic feature of acantholysis. So what happened, acantholysis is like spinosome is there, right, in epidermis. So that spinosome will be broken, right, that is called lysis, spinosome lysis, okay. So acantholysis stands for breaking of spinosome, okay. So here two antibodies developed, one against hemidesmosome, one against desmosome, so which is present in the epidermis, right. So that is the thing. So the competitive oriented exam, they will ask bullous pemphigoid. In bullous pemphigoid, what type of cells will be destroyed? That is hemidesmosome, okay, which is present in subepidermal area, okay. And in case of Pemphigus vulgaris, desmosome cells will be destroyed which are present in epidermis, okay. So biopsy, if you give a skin biopsy to analyze, okay, if you give skin biopsy to analyze the collagen disorder, okay, so to check autoimmune disorder. So here we can see if lesions, how you identify the autoantibodies will be, you can see in the subepidermal area. So here, okay. So that indicates if lesions you can see, if you see lesions in the subepidermal area targeting hemidesmosome, so all antibodies will be scattered here, okay. So that is known as bullous pemphigoid, okay. And if antibodies, if you see here desmosome, that is known as Pemphigus vulgaris. So this is a classical difference to identify which type of skin disorder you will be, autoimmune disorder you are having targeting desmosome or hemidesmosome, okay. So that is the thing. And one more thing to point here is Menkes disease, okay. Menkes disease, this Menkes disease because of absence of the enzyme lysyl oxidase. So this is a thing happening in the fibroblast, okay. If this enzyme is absent, you will be getting Menkes disease, okay. This is also you have to remember. All these 3 points are very important exam point of view, okay. Antibodies, autoantibodies which will be developed against hemidesmosome, it leads to bullous pemphigoid, and autoantibodies which develop against desmosome, Pemphigus vulgaris, okay. And Menkes disease because of deficiency of the enzyme lysyl oxidase. So that's all about collagen synthesis disorders. Thanks for watching.